Hello and welcome to everybody who's watching. If my sound's a little bit lower than Greg, the main reason is a little buzzing in the background, so we don't want to get people annoyed about that. And Greg, thank you for joining us.
Good evening.
Good evening. So, going forward, looking at all the stuff, quite a few questions. So, first of all, let's just... You're age 41. Is it your first go in politics?
Well, I've been in politics a long time. I joined when I was 17 years old, the Conservative Party, back in the 90s. But this is the first time I've been elected to Parliament, yeah. I did 12 years on a council when I lived in London, but this is my first time in Parliament, yeah.
And you've got a great shift, haven't you? So, yeah, also appointed Transport Secretary Committee, is that correct? In February?
Transport Select Committee, yeah.
Yeah, there we go. So cool. Right, shall we move on? We'll move on to the numbers first, if you don't mind.
Yeah.
So as of today, there was 51,608 positive cases. 5,373 people have unfortunately died. We have 300 cases in Buckinghamshire. Is there any information come your way about how many people in certain hospitals, whether it's a certain location in Buckinghamshire that maybe have more cases than the rest?
No, I mean, all of the Buckinghamshire MPs are in touch regularly with the Chief Executive of the Healthcare Trust, with the Chief Executive of Buckinghamshire Council, with the local Resilience Forum, everyone that's doing all the incredible work to keep us safe. And I think, first of all, given the statistics that you read out there, is our thoughts and prayers are with the families of all those who have tragically lost their lives to this virus, and it double underlines to all of us the importance of following the government advice to stay home, to work at home if you can, to only go out for food or for medical supplies, or to go to work if you absolutely cannot work from home, because this virus is a killer. And it's quite indiscriminate as well. There are people of all ages who have sadly lost their lives from it, and we've all absolutely got to do our bit to stay home, to follow the government advice, to not meet with people outside our own households, and to ensure that we're stopping the spread of this virus, because that's the only way we can save more lives.
So, yeah, stopping the spread. So, we obviously want to put any more pressure on the NHS, so that's where we're really going with the actual stay inside to stop the spread. I mean, there was an issue in Watford. I think they closed down one of the parks there. People were just going out and about, just doing, meeting up, which was obviously, it's a sunny day, it's in the weekend, and it is a bit of a weird thing, isn't it, that people still aren't adhering to the advice given, or actually the law, really, isn't it? If I'm right,
it is. It is the law, and the police have the powers to start fining people. And Thames Valley Police are taking a very common sense approach to this, but they won't shy away if someone is found and stopped being out with no good, legitimate reason that they're going to get food or medical supplies or helping a vulnerable person or going to work where they absolutely can't work from home. They will start fining people. And if everybody doesn't start playing by the rules, and there are millions of people in this country that are playing by the rules,
so it's the minority,
but there are some that still aren't. There are some that still aren't. If they can't play by the rules, then the government have already hinted that they'll have to bring in stronger lockdown measures, and I don't think anybody really wants to see that. But if it's what will save lives, the government will do it.
So have you been speaking to other members in the government in regards to what restrictions that might be? Further restrictions?
No, the government haven't announced what further restrictions might come, but it's pretty obvious the way we'll be going. Matt Hancock hinted about whether the daily exercise outside would come under question in one of the press conferences yesterday or the day before. And actually, I've really valued having that ability. I've been working from home for a couple of weeks now. I've really valued having that opportunity to go out and walk around the block and get a bit of fresh air, not least because we've got a 12-week-old baby in the house who tends to only sleep in the pram. But, it would be really, really sad if the ability for all of us to do that was taken away because a small minority of people can't follow the rules.
Yeah, I totally agree there. I mean, I've been self-isolating for an extra week because prior to obviously the lockdown, I was telling the mayor about this last week. Prior to the lockdown, there was a case where I could have been in contact with somebody who actually self-isolated. So I withdrew. So actually I've done an extra week, and it's well, with all the stuff I do with FPL, it's not as hard for me, I've got to admit, because I do a lot of stuff, as you obviously seen with all the stuff we did on the election, obviously pushing out the information there, making sure it's all democratic, and there's a lot of work that goes on behind the scenes. But for the people who are just going out there because they don't basically care, it is a worrying thought because they are spreading the virus.
Yeah, I think people have to keep in the back of their mind. That's all. Actually, not the back of their mind, the front of their mind. That by going out, they risk spreading this virus, and it might not kill them, but it could kill somebody else, and that is a really sobering thought. And I hope everybody out there that is even vaguely tempted to break government guidance, to break the rules, and to go out there and say that they don't care, they're going to do what they want to do, to think about the families that they may devastate by doing that.
Here's an idea, just thought about it. How about, if you really want to get out, you really don't want to be stuck indoors, volunteer for something. There's loads of help out there that's required. I think that's a better idea of using your time, and obviously you don't want to be stuck in. And there's a lot of people who do need a lot of help, which brings on to a couple of other questions about the health service. But is there any groups off the top of your head in Buckingham that are, helping vulnerable people that you kind of might want to say, and give them a little shout out?
Absolutely. I have been so heartened by the number of people that have come forward who are healthy, they are symptom-free, they are showing no signs of having this virus, who want to help their neighbours and their communities and their towns and villages. And across the whole Buckingham constituency, in fact across the whole county of Buckinghamshire, we've got many, many groups set up who are going out, they're doing shopping for people who are shielding or who are in one of the vulnerable categories. They're going and picking up prescriptions. We've got a fantastic example in Prince's Risborough, which is in the south of the Buckingham constituency, a scheme called the Risborough Basket, where, run by the town council and local town councillors in Risborough, have come together, and anyone that is shielding or self-isolating can phone up any of the shops on Risborough High Street, put their order in, and then the guys from the Risborough Basket will go and pick it up and bring it to your house. Likewise, in Buckingham, there is a Facebook group, in the town of Buckingham that is, there is a Facebook group where people can say they need help picking up shopping or whatever it may be. That's all being run through Facebook. People can go on there and find a volunteer. The Buckinghamshire Council have put together a number of community hubs across the county, so that they can get volunteer efforts through the council to go out and help people. And if people look on the Buckinghamshire Council website, they can find where their nearest community hub is, make contact with the teams there, and hopefully get whatever help and support they need. I know the church in Winslow is doing a great job in bringing the community together there. So across the whole constituency, there has been the most incredible, fantastic, great British spirit of people coming together and helping their neighbours.
And that's what's lovely to see. People actually helping each other out. I mean, my next door neighbour, they're in a high risk category, and if I'm going out, I do say they want anything. Like one of the biggest things, a bar of soap, believe it or not, I just said there's been quite a lot about obviously hand sanitizer and actually other stuff, but saying about soap is actually better, whether it's cheap, whether it's expensive. So shouting across the fence, so to speak, and I said, soap's obviously better, or what they're saying it is, and he was like, I haven't got no soap. So I threw him a couple of bars of soap, and he was like, do you want anything? I was like, don't worry about it, mate, you're fine. But soap can actually, I think, work better than hand sanitizer. There is a thing I'd like to just bring your attention, especially now we've done the shout out and trying to promote all the groups. Has the government got all the rights to literally it's no longer a democracy anymore in that respect, that the Prime Minister, by the way, sorry you're in hospital, and hopefully you'll pull through very quickly and help lead the nation, or continue leading the nation. But I've had a few people say to me, the Prime Minister still holds all the power, and there is no government, so to speak. There is no Parliament because everybody's gone home, so to speak. And with the coronavirus bill, it's kind of like a dictatorship and tyranny, and they've gone on to say more.
Sure. Look, what I'd say is, first of all, we all wish the Prime Minister well. We hope that he's out of hospital and back in Downing Street as soon as is humanly possible, but he went there on his doctor's advice as a precautionary measure for tests. As Dominic Raab said in the press conference today, he is still leading the effort. He is still the Prime Minister. He is still in charge of the country as our Prime Minister. And I think the government has done, as a Conservative MP I would say this, wouldn't I? But I really do mean it. I think the government has done a Herculean effort to get all the support measures in place to essentially go from a position where a couple of months ago nobody had this virus to a position where it is spreading across the whole planet at a rate of knots, and to get us into a position where we are fighting it, where we are containing it, where we are putting in place measures to flatten that curve and support everyone where we possibly can in terms of securing their jobs whilst everybody is in lockdown, really has been a Herculean effort. Now, the emergency powers are exactly what they say they are. They're emergency powers. No politician ever wants to introduce powers that essentially do give the police to fine people for simply being out without a good reason. But when it's life and death at stake, it was necessary to bring them in. And I can assure you that Parliament is... We may not be physically sitting in the chamber of the House of Commons, but I know that every single member of Parliament in this country are working their socks off along with their teams at the moment. We've all got massive mailbags, massive inboxes of people coming to us needing our help and support, getting clarifications from government on exactly what the guidance means for them, raising cases where perhaps schemes that have been put in place haven't quite covered specific circumstances, to try and get the Treasury or the Communities and Local Government Department or Business Department to fix those cracks so that everybody is getting the support they need. So, in many respects, MPs, we might all be working from home, but actually we're probably doing more at the moment than we do when Parliament is sitting in terms of representing our constituents and getting them the help and support they need from government.
Yeah, but while you're at home and there is no Parliament, can the Prime Minister pass any legislation?
No.
Without... He can't pass nothing. So people saying dictatorship is totally wrong. Nothing can get passed. It has to... You still need to do your voting, so to speak, in Parliament before you can pass any more.
So the coronavirus legislation did give the government quite wide-reaching powers to do things like enforce lockdowns with police support, etc. But they can't. No government can legislate without Parliament, and so Parliament. It was Parliament that put that legislation through. It was unanimous. Every party backed it, and it will be Parliament that repeals it when this crisis is over. And indeed, if on the 21st of April, when we're due to go back, if we're past the peak and the House of Commons can sit normally, it is highly likely that we will get on with the day job of the other legislation that was in the Queen's speech as well. So Parliament is here. MPs are talking to ministers on a daily basis to try and improve the situation. We can still ask questions of ministers. We can still talk to ministers informally as well. All that you're not getting is the scenes on the rather historic green leather benches of us shouting at each other. Actually, at the moment, the work is going on at pace just from the 650 constituencies of this country, rather than us all being in that chamber.
Are people finding it reassuring that you're still taking their emails and answering their questions? And
Yeah, I hope so. To be honest, I'm not doing this for thanks. I'm doing it to do the best I possibly can for the 83,000 people I represent in the Buckingham constituency. And I'm spending a large chunk of my day replying to people's emails, getting those cases into government where we need to lobby for change and for certain cases to be brought into the packages that have been announced, particularly to support businesses, and indeed talking to a lot of people on the phone.
I know that feeling. I've had a few people obviously speaking to me about a few of the questions, hence why I reached out to you and you so kindly accepted the invitation. There was a document I found. I mean, a big thing is that we had an issue in Aylesbury where a gentleman went into the hospital and he got arrested, and I think he got a couple of months in prison for it. He was looking around. Now, I did find, doing my bit of journalism, as they say, if you really can call me a journalist. Sure. And I'll just see if I can bring it up. Let's have a look. It's let me just. Basic about pathway, the patient pathway, discharging. 90. Are you aware of this? Are you the discharge? The
patient pathway.
Yeah,
it's a doctor-led. A clinician has to discharge someone from hospital, and then lots of other agencies have, if that person has particular needs, has to pick up to ensure that they've got a home to go to, that they've got the care and support they need.
Okay, so just to show everybody there, I'll just make sure I'll get your voice back in there.
Yeah.
So on the screen you can see that the discharge to assess model is based on using the 4 Clearway. So this is a big massive push. So the government did ask for 250,000 volunteers, which they got, I think, over 500,000 in the end. And this is what it's all to do with. So if you're going into the hospitals, you might not exactly see a lot of people there, but I do have a worry. I have worked in the NHS, by the way. I've worked with CRS project. That was a massive care record system, and I know how some of these flows work, and it does worry me because of the amount of people who back then, we're talking quite a few years ago, how the system actually works in the NHS. So we've got 50% of the people simply discharged, whether they want to or not. They're just being sent at home, with 45% of the people support to recover at home, able to return home with support from health and or social care. So that's a lot of people from a hospital being sent home, isn't it, really?
Mm-hmm.
4% of people needing rehabilitation, they're going to go into social homes, care settings or whatever. It might not be their place where they would like to be, but it's just about getting them out of the hospital. And then 1%, obviously, they've had ops done or any other ailments, and they do need to be obviously looked after, so they have to be held at the hospital. But I've also heard things from people who work as private ambulance people who have been utilised as part of this initiative, where they're saying they've been asked to take on 2 people or 2 patients. They come out with a mask on, but they don't come out with any gloves, which to me, the ambulances should be obviously staying sterile, so to speak, or unless they wash it down after every turn. But so you've got the driver, you've got the person who looks after the patients in the back and sits in between these 2 people, and 2 metre rule isn't really going to count. Do you know anything about that, or is that
I haven't, but I can certainly take that up with the Healthcare Trust as to how that is working in practice. I mean, what I know from Buckinghamshire as a whole is that there is still capacity in all of our hospitals. Obviously, the main 2 being Wickham and Stoke Mandeville.
So when you say capacity for COVID or for just
COVID capacity, ventilator capacity for anybody presenting with COVID symptoms. Likewise, Buckinghamshire Healthcare NHS Trust have slightly reorganised the way services operate across Stoke Mandeville and Wickham to maximise their ability to ensure that people who are still sick and need care can access it if it is not COVID-19 or the symptoms of COVID-19 that they are presenting with. I mean, for example, one constant that the NHS can't do anything in terms of saying, well, this can wait, because it clearly can't, is that many women are giving birth. And so they have moved all maternity services to Stoke Mandeville. So anyone that was planning to give birth to their child in Wickham Hospital is now being asked to go to Stoke Mandeville, so that they can ensure that there is that centre of excellence at the Aylesbury Birth Centre and the labour wards at Stoke, to ensure that mums can give birth safely during this crisis at that birthing centre. So the Healthcare Trust have done a lot of very careful planning, a lot of medical-led planning, to ensure that there are as many services as can still be offered on top of caring for those with symptoms of COVID-19 at this time. So it's not a case that simply all other hospital services have been turned off, but obviously there has, out of public safety, had to be some rationalisation and change in the short term while we get through this crisis.
Yeah, but this document clearly states 99% of hospital patients are going to be discharged or have been discharged. And is there anything is there any information or obviously charts and figures and graphs regarding how many people have been moved and how many people, has anybody died from this scenario? Because I'm sure there is families out there who are impacted by this move. I mean, especially sending people home. And again, I must reiterate to people, I've looked at this information, and it clearly states in this document, all funds will be available to all hospitals to do what they can to move these people. So I'm not having a go at the government. I'm merely just overlooking and making sure that certain avenues are looked after. And this is a case of people who are not COVID. They've been told to, they're going home whether they like it or not. And, making, is there any checks and balances? It does say that there is, but where are all the stats to show that people are being looked after? Yeah, there has been. Yeah. I'm sure people have probably passed away, unfortunately, in this mass exodus of patients from the hospitals. So I've not seen any of that information.
Well, what I'll say is, in all the briefings I've received, I have not been told of anybody who has lost their life because of a change in the way the hospitals are providing services. Okay. Now, I will follow that up with the Healthcare Trust to get the most accurate information as possible for you. Certainly, I have not seen in any of the briefings I and other Buckinghamshire MPs have been given that to be the case. Yes, we've seen changes like the maternity changes I just outlined. Yeah. I have not been briefed on any statistics around loss of life through that. What the government has said is that elective surgery is postponed, but urgent surgery should carry on. And indeed, I've actually represented to government a couple of cases of people who actually were due to get treatment in the private sector, cancer treatment particularly in the private sector, who, because private hospitals have all substantially shut down, need to now access that treatment in the NHS. And so I can assure you that the NHS are taking in urgent cancer treatments and ensuring that people that need that urgent treatment are getting it. Okay,
all right. It's interesting you said that about the private sector. That's very interesting that they've closed down. I would have thought they would have been.
Well, they've essentially turned over to some private hospitals. The private hospitals, to clarify, aren't running as they normally run. So some private hospitals, they've all essentially become part of the NHS for this crisis. And the NHS is directing what should happen in them. Some private hospitals are becoming entirely COVID-19 hospitals. Some hospitals are carrying on with treatment plans where they can, where they're properly and safely equipped to do so for other urgent surgery to ensure that healthcare across the piece is happening, but it's all being done under the clinical direction of the National Health Service.
Okay, so is there information out there to direct people to say this is going to be COVID hospital and this is going to be other services? Yes. Yeah, okay.
Yeah, I believe that is in the public domain. I mean, I know that, for example, the private hospital in Great Missenden is taking on a lot of the cancer treatment that they're equipped to do for the county, freeing some of the NHS sites to focus more on COVID-19.
Like I said, I've worked in the NHS, and I know how hard everybody does work there, and you know, it is understandable that they're going to be under tremendous strain, especially with something like this, where you're basically the exodus of 99% of patients in, obviously, the COVID hospitals, I suppose, in a way that you're saying. So that's interesting. We've got a few people putting questions on, which we'll actually have a look into that in a moment. I mean, their quote in that document, by the way, was why not home? Why not today? Discharge today should be the default pathway. So that was the bit about that. Going back to Mr. Hancock and what he said today, he's saying about the 100,000 tests for these antibody tests.
Yeah.
Oh, sorry, for the actual COVID tests. Do you think that's realistic? Do you think he'll be able to actually do that?
Yes, I mean, I don't think he would have stood up at that lectern and said that he could do it if it wasn't a realistic target. Now, the whole question of testing is clearly one that has raised some questions, particularly from parts of the media in recent weeks. The most important thing is to get the tests that are reliable.
Yeah.
Particularly with the antibody test, I believe a big part of the problem is that some of the products to do that have been delivered are producing a lot of false positives. And a false positive is about the worst scenario that you can get. Someone who believes they've had it, believes they've got the antibodies, then goes into society and in fact doesn't. And so, yes, the government is absolutely committed to getting up to that number of tests, but particularly the antibody one that isn't scientifically proven to fully be reliable yet. There is no way the government will allow a test that isn't reliable to get out into mass numbers into the country, and so they've got to be absolutely certain that those tests are as reliable as they scientifically can be before deploying them.
Okay. Well, it goes without saying, really, doesn't it? I mean, the question does get asked. I watched the updates, which I was annoyed about the BBC update, where they cut the feed before the question had been answered or even fully asked. But yeah, I mean, it has come up there, and they keep on stating, look, we don't want to do this false negative thing. We do want to make sure that the information is correct, because there is that question about people who had COVID and now literally are saying that they're okay, and then can they go out in the public? I mean, that's one of the biggest questions, I think, is going to, as more people obviously have been affected by it. As we chatted about earlier, obviously you had a cough and you thought, was it or wasn't it? But you need to know the information, don't you, first, before you can move on. I mean, another question come up to me is Dr. Jacob Glanville of Netflix, a pandemic. Is the government looking at or in the means of chatting to, I think it's BioDirect or something they're called. You're aware of that in any shape, way, or sense? He's been working on basically on Netflix. Do you have Netflix?
I do have Netflix, but if I'm being honest, it is more for my 3-year-old to watch on long car journeys than me to find any time to watch telly these days. But yeah.
This is what I got a few people saying to me. Oh, you got to watch this thing called Pandemic. It's on Netflix, and I was like, I saw it back in January, to be fair. And the gentleman there, the doctor, they've been working on an antibody that does all influenza. So the questions people are saying to me, you got to watch it, which I've been trying to do while trying to do some other research and speak to other people. It's quite interesting, and it's like they're saying that they can release something in September. I mean, you've not heard anything, so maybe you can find out whether or not they are looking at that. That'd be quite nice to know, because you need about seven jabs, and they're trying to reduce that to a few because nobody wants to get jabbed by the doctor. But that is one of the biggest things I've had from a few people.
That's a flu jab, is it? that you're talking about?
It is. It will. It will. Apparently, it can deal with the coronavirus. It will cover like basically all the influenza things, but it'll only last about 8 to 10 weeks. But can start working within 20 minutes, from what everybody keeps on talking to me about. And this is what's nice having a new one.
Well, I can ask the questions of the Department of Health, but I think if there was a vaccine out there for coronavirus, it would be all over the press conferences by now, and the Chief Medical Officer would have announced that it exists. So this government is being absolutely science-led on its response to this crisis. The Chief Medical Officer and his deputies, the Chief Scientific Officer, are absolutely leading what is right, scientific and medically possible in this crisis. So I'm sceptical about talk of the vaccine when actually in some of the press conferences in recent days the science officers of the government have been talking about months of clinical trials to get to a point of having a vaccine or some sort of cure for the virus. So, but if one exists, that's fantastic.
Well, again, if they've not heard of it, there you go.
Yeah.
You know, you can say, well, you know, people from the interview, this is what they said. But that's some of the questions I'm getting. I'm getting
Sure.
quite a few people saying that.
Sure.
So if I didn't pass it on, what was the point about doing this? So thank you again once again for
Yeah.
coming on. I mean, there was another thing about 5G towers as well, about the 5G
Well,
rollout.
that's just that. I'm afraid that is one of those things that has absolutely no scientific basis to it whatsoever. It got a bit of traction on social media. Then a couple of let's thought they'd run with it. And what's the net result? We've seen people setting fire to 5G masts.
I know.
I'm afraid I'm afraid it is one of those conspiracy theories that has somehow got legs, but everything I've seen, everything I've heard from the science of this says that there is no way on earth that coronavirus, or indeed any virus, can be transmitted over the airwaves using 5G, 4G, 3G, or whatever.
Well, I think the traction there with the 5G thing is it's about radiation poisoning, so to speak, or destabilising the body's magnetic core, so to speak. That's where that really is coming in with the 5G. It's spreading coronavirus is like, no. But, again,
Yeah.
I didn't say anything about it. I mean, with the 5G rollout, don't know if you know anything about it, you know, you know, it's in the major cities. There's been no reports
Yes.
of
No.
I mean, it's massive in China, 5G, and there seems to be no massive things coming out about that really, about it causing anything yet. Or are you aware of anything
No,
else that I have not got?
No, I mean we have these scare stories around technology every time. I mean, I remember when in the sort of the late 90s when mobile phone masts were going up 10 a penny around the country, everyone saying
4G
that.
network.
Well, I'm going back to the 90s when the original mobile phone masts were going up in vast number. Then the 3G masts through the noughties, 4G in the last decade, etc. We've always had the theories around them. The science, as far as I'm aware, has disproved all of those theories that mobile phone masts are somehow bad for our health. But what I don't know, I'm not a scientist, I don't know exactly the impact mobile phone technology has on our bodies, but what I do know is that I've seen reports that the science categorically says mobile phones are not, or mobile phone airwaves are not spreading coronavirus or any other virus. What I would suggest, given that as well you have to wash your own hands very frequently to stop or to minimise your risk of getting this virus, given that we all touch and handle our mobile phones, the actual devices themselves all day long, it wouldn't be a bad idea to sanitise those a couple of times a day as well.
Yeah, again, using soap apparently that can help actually clean them up. It does reduce it quite well. There was a thing on BBC News. You can have a look at that. But the fight, like I say, the 5G thing, I think a lot of the conspiracy theories actually going about is about raising the awareness of the radiation that's been pushed out by the increase of these antennas. It's not, the coronavirus, again, it's spreading it. Does make me laugh. But I think New Zealand, I think, have they stopped the rollout? I think that's something due to issues that they might be having with the 5G network or 5G distribution systems.
If they have, I haven't seen any briefings on that. If they have, I suspect it's got nothing to do with coronavirus and everything to do with some sort of technological issue or difficulty.
Yeah, no, I agree with that. To me, being a bit of a geek, looking at all sorts of things, when you transmit something, it's obviously going to have some kind of wave form, which obviously if you put too many in a certain area, it can cause obviously issues. I mean, there was a thing going back, you said about 1990s. It was about Wi-Fi did actually affect people who were actually
the early Wi-Fi did,
yeah. If you remember that, yeah. So I think this is along the lines with the 5G and about its transmission and about the amount in a certain area, because with a 4G mast, it's quite distanced apart. With the 5G, it's actually there's quite a few in a certain set block. I think that's what that mainly is. Are you ready for some questions? What people have wrote? Do you mind? Shall I read some out?
Yeah, go for it. Let's go for it.
Let's have a look. We got Richard Tweed. Can you ask the government strategy is based on figures being potentially 500,000 people dying, and then the chief advisor backtracking saying only 20,000 potential will die?
I think the 20,000 figure is the more likely figure, but let's be very clear about what is happening. This virus, if we don't all stay at home, will spread and spread and spread. And the reason that the government is asking everyone to stay at home is to both save lives and protect the NHS. Because if we weren't in lockdown, the NHS would, or no health system anywhere in the world, would be able to cope with the volume of people requiring hospitalisation to hopefully get them through COVID-19. Worst case scenario, sadly and tragically die because of COVID-19. And so what the actual number is at the end of the day is hopefully as low as can be achieved, as low as is humanly possible. But it will be different if people don't follow the government guidance and stay at home, because if people start thinking, oh, it's all right now, or we can go out, or we've been at home for a fortnight now, actually that total number of lives lost will increase. Because the virus will start spreading much more rapidly. The scientists are leading our response to this. The numbers that they give will be the best guess that anyone can have at them. But at the end of the day, this is about human interaction. The virus doesn't spread itself, humans spread the virus. And so that number could rapidly change depending on the way people, not just in this country, but people all over the world react to it.
Let me just jump in there, if you don't mind, just quickly. There is, I broke down the other day, so I went out, got some shopping, dropping it off to the girlfriends, and actually my fuel pipe went. So I had to call out the AA. So thank you, AA. Thank you very much for getting to me within half an hour. I felt like a right idiot. Obviously, just stood at the side of the. I obviously got to a safe place. So the AA gentleman came out and repaired it quite quickly, which was luckily, I was sorted and sent on my way. We did have a little chat though, which was interesting. Being the way that I am, I had to ask a couple of questions, like I always do. And he said, I was like, "How busy are you? Is there obviously probably not that busy because obviously people are obviously adhering to the advice of the government, staying at home." And he said, "Actually, no." He goes, "I haven't dealt with one case from a key worker yet." Again, that made me look bad because I'm like, well, no, I was dropping food off. She's isolating, and he's like, I can see that you're fine. But it's an interesting case there that AA and RSC, and he said they all talk, and he's saying not one of them have got a key worker, which is it does make you think like. You're driving places. He's putting himself in the way of line, and it goes to the key workers as well out there. My daughter works at Halfords, and the time she says to me about people coming up asking for air fresheners. They've popped into Halfords for an air freshener, and it's like, and they've said no, go away. That's not crucial. We're here to obviously try and push forward, and allow key workers to have like bikes and cars fixed and stuff like that. It is really weird that the mentality some people are doing, and with the breakdown services, again, these key workers of these people out there, again, putting themselves in the way, in the front line, because you want to get in your car and drive somewhere where you don't really need to be. You don't need your car, but you're putting them, fair enough. They say, well, I haven't got it, so what does it matter? So there is that.
Well, this is the thing. Let me come in there. This is the thing. People saying, I haven't got it, I'm afraid, just because you don't have the symptoms doesn't mean you haven't got COVID-19. Because we know that it can have a 14-day incubation period. For all you know, you're on day 13 and you're going to get a sore throat, a cough, a temperature the very next day. And what the science does tell us is that you are most contagious just before and just after you start to show symptoms. So actually, that is why it is so important that you stay at home unless you absolutely have to go out. And what do we mean by that? We mean going to get food. We mean going to get medical supplies or some sort of medical treatment. Supporting a vulnerable member of the community, like you were doing, dropping someone a food package off who was self-isolating and couldn't go out and get food themselves, or perhaps dropping food to an elderly neighbour. And going to work if you absolutely can't work from home. And everything else, frankly, unless you're having a walk around the block for a bit of daily exercise, and by the way, the government really does mean a walk around the block. It doesn't mean get in your car and drive to your favourite park 20 miles away, or go to, as we saw, images of people lying on the beach in Brighton over the weekend, driving for a couple of hours to go to the beach. It means, go out and get some fresh air, walk the dog around the block, or, in my case, push the pram around the block to try and get the baby to sleep. Because nobody really knows whether they have got this thing or not because of the long incubation period of it. So I really do beg everybody to stay at home unless there is a very, very good reason, like one of the ones I've just outlined, to go out.
I don't think you can say any more. To be fair, that literally does say it, doesn't it? Don't go out, and like you said, you don't know if you do have it, and like I get to stay 2 meters away from the AA guy who was so nice, and it is a weird one. You don't know, so do stay at home, and if you do need to go out, observe the 2 meter rule, and don't go out unless necessary. There was another question I was about to say to you. With and this stems from the AA guy, to be fair. We saw 2 trucks going past, and the side had been ripped open, but actually it looked like it was some kind of like porta cabin or structure. And I said, that's probably going to the hospital, or at least because Stoke Mandeville Stadium is going to be like it's going to have obviously beds in there for the influx of people that might happen. I mean, again, going back to the 99% of people have been basically been not kicked out of hospital, but for this sake, I'm just going to say kicked out of hospital in a kind way. Obviously, is there going to be is there something underlying that isn't really coming through at the moment, or is it just in preparation? Once, obviously, at some point we do need to go back out again. Is it for that reason that they're increasing the beds? You've got the Nightingale and dotted obviously around the country. They seem to so hospitals like the Nightingale at the Excel Centre in London are there to provide 4,000 beds, so that when the peak comes, and there's a lot of speculation about when the peak is going to come. Some people say it's this weekend. Actually, we don't know when that peak will come, but when the peak comes, it is the government, it's the Department of Health, the Chief Medical Officer, ensuring that the bed capacity exists in our NHS to ensure that everybody that needs a bed, everybody that needs a ventilator to help them survive this thing, has one.
And so, yes, there has been a lot of very urgent construction. And didn't everyone that put the Nightingale together do the most incredible job to turn exhibition space into a 4,000 bed hospital in basically a fortnight? That was an incredible piece. It was slightly less than that, but from planning to opening, it was about a fortnight. And that is an incredible thing to ensure that our NHS and the heroes that work in our NHS are able to look after any of us, ourselves, our family, our friends, should they require hospitalisation for COVID-19, or indeed require urgent treatment for any other illness that they might succumb to during this crisis.
Question just off the top of my head from a gentleman who wrote in a couple of days ago, as in on one of the other streams that we had, and he said about if we're moving to people to other little hospital, community hospitals or something for their treatment, does that mean people might be able to go in with them, so to speak, obviously in their recovery stage, because obviously the COVID hospitals are going to be the major hospitals, or are we literally going to, obviously people still got to stay at home?
I think the main medical advice, although I'd always urge people to check the government website because the advice is updated daily, I think the major advice, I'm afraid, is still no, stay at home, because most NHS hospitals will continue to have COVID wards and non-COVID wards. The Nightingale is an entirely COVID-19 hospital, but Stoke and Wickham will both continue to have, in our neck of the woods, will both continue to have COVID wards and non-COVID wards. And so, whilst I know it is so hard, it is so difficult for people not to be with their loved ones, able to visit their loved ones when they're sick and they're getting hospital care, I'm afraid the greater good of stopping this virus spreading and saving more lives overrides that. But believe me, I know how difficult that is, to be told you can't visit someone in the hospital. But we've got to stop the spread of this virus.
Yeah, I mean, the biggest problem here is people not being able to visit, isn't it? But the point is, if they've got the virus, they might have the virus and they might spread it in, and that's why they're saying still no to visitors, basically. I mean, an interesting thing as well is after my chat with the Aylesbury mayor, they closed the cemeteries down, or the cemetery in Aylesbury, to visitors, which is, to me, I obviously got to take that up with them again in another broadcast. But what's your take on that, on them closing it down to visitors?
Yeah, of course, the one thing where there can still be, certainly not how they used to be, but where there can still be something of a gathering, although it is very limited, is of course a funeral. The cemetery, I can understand why Aylesbury have wanted to do that. Of course, you've got to be very, very careful about where you're allowing anyone to muster, to gather, where they might come into contact with other human beings, as well as it's a reality that this virus can survive on most metals. So anyone that has opened the gate who has got the virus could well leave that virus for someone else to pick it up 20 minutes later. And so there is no safe way of completely stopping the spread of this virus, but we can minimise the spread of this virus by not going out, by not touching the gates. I know that sounds slightly ridiculous when you say it out loud, but actually it is the reality.
In the supermarket.
It is the reality of this thing. Tesco's, I know, in Aylesbury are sanitising the trolleys after each use, and a good thing that is too, because you cannot do enough to try and slow the spread of this virus.
Well, I can say that's where I was the other day when I come down and obviously broke down. They actually sanitised as you walked in. They gave it a wipe down.
Yeah.
So again, I wasn't aware whether or not they were doing it outside and cleaning them down, so that obviously when you take it, it's already been cleaned down, so not aware of that. But
I don't know.
Yeah. I mean, they cleaned down the the handheld machine. They said, "Did I want one?" I was like, "Yes, please. I love the scanner thing." So it makes things a lot easier and allows me to go through the checkout. Which, to be honest, that's what you kind of want. You don't want to be. I mean, there is a big queues there of people saying they didn't want the scanner, and I said, "Take a pair of gloves." You know, if you're really that worried. And so, I mean, they wiped the whole scanner down, so I was a bit like, well, why not just use that? But it was interesting. I heard a couple of people as I was receiving my cleaned scanner, so I was a bit like, oh, that's up to you. But very weird that people were saying no. So I mean, I think I've covered a lot of my questions, what people have asked and the way they pushed them through, and I'm sure at some point you wouldn't mind coming back and maybe catching up.
Sure.
Detailing some information or at least putting some links down for people if you could, especially the voluntary organisations who are asking for help. I mean, from your point of view,
of course. Whenever I discover a voluntary group, I always try and put it on my Twitter or Facebook. Indeed, there are so many fantastic local businesses across Buckinghamshire who have adapted the way they do business to help during this crisis. So whilst obviously most of us, when we think about food, we think about the big supermarkets to do our weekly shop, but actually so many of our smaller independent food retailers across Buckinghamshire have started up delivery services. I can think during my household's isolation, we live in Wendover, and not too far from us is Orchard View Farm near Alswick. Farm shop, they've started doing deliveries. We've had some fantastic meat from their butchers and other supplies. So if you can't get that big supermarket delivery slot, don't think that's the end of it. You're not going to get any food. Do also think about our local butchers and farm shops and other food retailers around the county. Everyone knows where their nearest farm shop is, I would imagine. We've got a good number of fantastic ones across Buckinghamshire. Drop them a line, look on their website. Chances are they're doing a delivery service too. Our breweries, the Chiltern Brewery is doing drive-through beer, where you phone them up, and you order your beer, you pay for it, you tell them what your car registration is. When you get there, you beep your horn, they bring it out, put it in the boot, and you drive off. So you can still have a
drive-through beer. Have you used that service? Is that what you're saying about it? Is that...
I may have used that service, yeah.
Oh, okay. Sorry, another thing that did come to mind was a finance package the government is offering. Now, me as a small company, I think you've seen the size of my operation. I kind of do things of loads of help with friends and family, and some of the finance packages that are out there are, I'm falling right between the cracks. It's quite unfortunate for me.
Yeah.
But
so I think that the overall package, the feedback I've had from my constituents is the overall package has gone beyond most people's expectations, particularly the job retention scheme, where the government, for the first time in history, the British government is stepping in to pay people's wages so that they've still got a job to go back to after this. Likewise for 90% of the self-employed, 80% of their average earnings up to £2,500 a month is being covered. I am, however, taking up very strongly with the Treasury a couple of areas where I think the government does need to complete the last couple of pieces of the jigsaw puzzle, if you like. One of those is small companies, owner-directors, where perhaps it's only them or one or two other staff, who equally, probably more often than not, perfectly legitimately pay themselves mostly by dividend rather than PAYE. Yeah. People in that category have definitely fallen through the cracks, and I've written to the Chancellor a number of times with specific cases, and actually earlier today I wrote to him in a more general way saying, look, we really do need to plug the gap here, because there are a lot of people who are in a very desperate place at the moment who have structured themselves in that way. And secondly, around there's this £50,000 cap on the self-employed, where if you've earned over £50,000 a year for the last few years, then you don't get the self-employed support. Now, I understand why that is in place from one end of the spectrum, but actually that's caught out quite a lot of people who maybe earn £55,000 a year through their self-employment. They're probably geared in debt up to that, whether it's their mortgage at home or whether it's finance packages they've got on equipment or vehicles to actually do their business. And those bills obviously do need to be paid. And so I've also asked the Chancellor if he will look at that again. But as a whole package, I'm really proud of what Rishi Sunak and the whole team at the Treasury have delivered. That essentially means we are going to have an economy to go back to after this crisis. People are going to have jobs to go back to after this crisis. And it really has been an extraordinary few weeks where the Treasury has had to react in virtually no time to a place where essentially the government is paying people's wages, and hopefully that will see us through this and mean that the economy can be strong again quicker than otherwise it would have been once this crisis is behind us.
It's a good point. I mean, where I was coming from is there was 80% has been backed by the government, and the other 20%, the banks are turning around and saying, you got to put your house up. I mean, I know there's been a limit. I think it's 25,000 or 50,000.
So, yes, when the Chancellor first announced the government-backed loans, a lot of the banks ran away and basically went down the business as usual track for them. And that's not what the government asked of them. And fresh guidance was issued by the Treasury to the banks on Friday. To try and fix some of those problems, to stop them asking for massive personal guarantees on these loans, because that wasn't the point of the scheme in the first place. And hopefully companies now can start to get the loans they need, the government-backed loans they need for their business continuity. And I would encourage any business in Buckinghamshire that is struggling to get the support that they think they are due during this crisis, to get in contact with Buckinghamshire Business First. If you put that into Google, you'll find their website. They're offering some fantastic support to businesses, and they're also administering a £2 million fund that has been put up by the Local Enterprise Partnership as an additional source of funds to help Buckinghamshire businesses through this crisis, and they're administering the process by which businesses can apply for that.
Okay, what about people with bad credit? Are they going to be able to access these loans? That's another question.
They should be able to, so long as they are a viable business. The question on this is was the business viable before the crisis hit? Of course, the crisis in its own right will make a lot of businesses non-viable, which is why the government is stepping in with these various schemes, be it the business rates relief, VAT deferral, the job retention scheme, the business continuity loans, whatever it may be. If the business wasn't viable, let's say in December or January before this crisis hit, then there is a legitimate question mark over whether the taxpayer should bail that company out.
So let's just say, for instance, FBL. FBL has been. I mean, we're doing this. We're in our third year now. Wow, and we've covered so much. Live in the park and all the stuff the Town Council. Obviously, the drop of a hat. We thought we'd cover the elections and cover the hustings, and we have Joe Morrissey on Wednesday from Beaconsfield on. Hopefully, we've still got to confirm that. But so as I've been trading, coming into my third year, you're saying I'm a viable company then. Where if you just started a company up in December, that's where the issues are going to be. That
is a more tricky place to be. But again, I would encourage people to talk to Buckinghamshire Business First, because they've got people there that can help and advise and get people in the right place to access the right support that the government is offering.
Okay, again, I'm joint to Bucks Business First, so I've been to a couple of their meetings, and it is worth joining. You don't have to pay as well. It does actually say that there's certain types of membership, but you don't have to pay, and especially if you're starting up, it's really handy.
For their coronavirus support, there's no question of membership for them to give coronavirus support, advice, or indeed help you access the £2 million fund from the local enterprise partnership.
That's really good information. I'm glad we've done this interview. There is something somebody's just actually mailed in, which was quite an interesting one, and actually I did miss it when I was going through my stuff, which is the coronavirus. Oh, getting tongue twisted. I think I need
coronavirus.
Yeah, the coronavirus. It's not classed as. I'm trying to find it here. It's not classed as a HCID. So as of the 19th of March 2020, COVID-19 is no longer, this is done by the government, is no longer considered to be a high consequence infectious disease. Do you know why?
I think there was something around a government website that listed those things in January being... Yeah, I think it dated back to an entry that had been put on a website in January. I will happily... Yeah, I will happily find out the detail behind that. I don't think it is how it should be on whatever page on whatever website that currently is.
Yeah, I mean, I have been still. I mean, the message just come through. I just saw it pop up. It was like, ask about a HCI. I was like, oh, okay, yeah, good point. Because I did look into this, and I was a little bit like, because it's now. I mean, it does say it's now an IPC, infection prevention and control. But yeah, if you could look into that and get back to us, that'd be greatly appreciated. Or maybe we'll catch up next week and maybe you can update. But that's quite scary, I think, because people will go to, I mean, especially being the government site, they're going there and they're seeing that this is no longer, a high infectious, disease. Why are we in lockdown? Why should we bother? It could lead to the conspiracy theories, you see.
I would advise everyone to look at the specific coronavirus COVID-19 pages on the government websites. They're being advertised all over the place in virtually every ad break on the telly, on billboards, etc. Everywhere you look, those sites are the sites to look at. Watch the news. Watch the press conferences. If you compare to watch politicians' press conferences, it's where
that's what we're doing.
Really been given out.
Yeah, I totally agree. But when it is set on the government site, that is a worry. So is that something you just look into? And
I'll certainly look into that.
Okay, thank you very much. I'll just see if anybody's now put a question on the chat, which they haven't there, and nothing else is coming through here, which is good. I think we've been talking about an hour, so it's been very informative. Thank you very much. And once again, I don't think, in case somebody messaged me again, in the certain areas. I mean, I haven't got my Twitter up. I don't think there's any more really. And I mean, being an hour has been amazing, and it hasn't felt like that, by the way. So, is there anything before we finish up, or just before anybody else tweets in or messages in? Anything else you want to add? Any special thanks to any certain organisation
Let's say, first and foremost, a massive thank you to everybody that works in our National Health Service, to the doctors, to the nurses, to the porters, to the cleaning staff, to everybody that works in our NHS. You are all heroes, every last one of you. And likewise, all of our other key workers, our police officers, our council staff, whether they're care workers or social workers or the guys and girls that empty our bins, everybody that is out there keeping Britain rolling through this crisis while most people are locked down, are all heroes. And I cannot thank everybody that works for whatever tier of government, be it national government or local government, enough for the work they are doing. Likewise, all the volunteers, all the businesses that have completely changed the way they operate to help get food deliveries out, and so on. The spirit of Britain coming together and getting through this crisis together, which always culminated in the address by Her Majesty the Queen last night, who gave us those very wise words on national television, saying, "We will get through this, we will beat this," and to echo those famous words from Dame Vera Lynn, "We will meet again."
Very nicely finished, sir. That was nice. Once again, Greg Smith, MP for Buckingham, thanks for coming on the show, and we look forward to seeing you again at some point.
Pleasure. Thank you.
Be safe. Thank you.